Hello everyone, Assalamu alaikum. My name is Shahir Ahmed and I'm a student of Bachelor's in Biosciences at the University of Page, Hungary. Presently, I'm offering my services as a international student ambassador for the University of Page. My main job is to help all the prospective students in their application, their arrival, and their prior settlement in Hungary. Uh, I would also like to introduce our guest speaker, Ms. Sadia, who will be joining us for the webinar and start talking about the effects of therapeutic drugs on mental health. I would like to ask Ms. Sadia to introduce herself to the general media.
Assalamu alaikum, and thank you so much, Vijay, for a great, kind, and brief introduction. This is Sadhya, and I think this is our second interaction on the platform of Seven Biotechnologists Association. And this is my pleasure that I'm again with you with a very, very important topic. And I know that this topic was evaluated by the poll, and you all people want us to talk about the therapeutic drugs basically and what are their effects on the mental health. So for sure, this is very important topic, and we will try to be very, very simple and explanatory, and try to help you all to understand it. Thank you.
All right, thank you very much. To start our session, I would like to describe the main theme of our today's topic, what we'll be discussing. In this webinar, our prime focus will be on the effects of therapeutic drugs on the mental health. And during this topic, we'll be discussing all the subtopics that are associated with it. Uh, while we're discussing the different topics, I will suggest all the viewers, all the persons who are watching this, whenever you have any questions, any comments, you can write all your queries in the comments, and we will be happy to answer them as well. Alongside, our colleagues will also be answering your questions in the comment section as well. I will try to open up the presentation that will be of our main subject. I will try to share my screen here. All right. I hope you can see the screen now, Miss Sadia.
Yeah, it's very much visible. It's all right.
All right. So starting off with the main topics, we will be focusing on the principles of psychopharmacology, the site of drug action, the neurotransmitters, and the neuromodulators that are inside our body. So, Ms. Sadia will start with the principles of pharmacology, which is the roots of administration.
Okay, thank you, Shahir. So let's start with the really, really non-famous. I will say that the term which we will explain today first, that is psychopharmacology. Um, okay, these are amazingly two words. One is the psycho, and other part is the pharmacology. So psycho means that everything which runs inside the brain and which your brain contains, that have all the chemistry, biology, and in a very, very easy word you can say all the makeup of or the genetic makeup of your brain, that how it works. And then the pharmacology is the we term uses that the
Mhm.
study of drug action and study of drug and their effects. But when it comes with the psychology, so psychopharmacology basically the mode of action of some of the drugs which mimic like reward of the brain.
Mhm.
So this term, that reward of the brain, make it sure that everything which comes into your body that have a reward system, your
Oh,
body runs on a reward system. So everything that comes up within your body, it do have some of the effects on your body, and then body will metabolize it in certain ways and take out its own rewards. So that is basically the reward system. When it comes to the brain and when it comes to the drugs, so mostly the very famous drugs or the drugs which are we normally use, that are the painkillers basically. So their reward system or their effect in another words, that merely describe that how your brain will react to that. Normally, not all the drugs is very much suitable and very much affected or effected on your brain, because mostly drugs, they cannot cross the blood-brain barriers. A very few drugs, a very few therapeutic drugs are there who can cross that barrier and who have the very long-run effects on your mental health also. So some of the drugs which have very very short-term therapeutic effects, like if you are taking the painkillers, they have a very very short-term effect on your brain, and then after that your body will squeeze it out and your body regain itself. But when we talk about the therapeutics, so therapeutics mean merely that there is some prescription, some system of the medication, which you will take for a 1 week of period, for me 3 days, starting from the 3 days, 5 days, 1 week, or maybe long term, maybe
Mhm.
whole life you can take that drug now. So if you are taking those drugs and if you are taking that sort of drugs that do have some of the effects of your body, because then body will get to know those drugs as their own system, and if you will not taking that drug for a shorter period of time, your body will crave for that. Fine. So I am using this word craving. So obviously we usually use this word craving for the foods, but when your body be very very much assimilated with that some sort of drugs, they get craving of that, they have the craving of that drugs. So that is basically the problem, which we will talk today in a very detail. So within the principle of the pharmacology, we will first discuss you, we will first tell you about the different routes of administration. The very first route which you can see on your screen, that is a very famous route, that is the intravenous injection route, which is the fastest one. Everything which will come into your brain, in contact with your brain, that is direct part, that direct biggest fluid of your body, having all the chemical reaction in it. So if this first route is IV route, this is a very very effective and very very fastest route. Suddenly all the drug will go into the brain, absorbed by the blood, sorry, and then it will start its working. Then the second route, and remember this, these routes also matters when it comes to the effect on your brain system. Now these routes also matters, that which route you are assembling and which route you are getting the drug. So that is also important. Then the second, the route of administration of any drug can be, intraperitoneal, that is IP injections. A very very common example of this IPs are like the insulins. Normally, most of the households, the aged people within the Pakistan, because the diabetic ratio in Pakistan is very much high. So I think most of the houses, the one or two people are getting this insulin. So you even might have seen that they took that injection into their peritoneal cavity, abdominal area, because that area have the very less sensation. That is the one part that the area has a very less sensations. So, and the second one is, this is the second part of that, that if you are taking the drug from this route, your body will slowly administer the thing, and it will be, because it is very very closer to the liver and to the heart area, so your body easily assimilate and your liver easily assimilate these sort of injections. Then another route, if you can just change it, swip the slide. Then other route of administration is IM, the third very much important route. Normally most of the injections, they get into the muscular insertion. So those injections which have the muscular activities, they absorb by the blood, and that is supplied by the muscle. Your muscles get the supply of that blood, and then that assimilate, and that will go into your system. And the third, second last one, that is the subcutaneous injections. That is just beneath your first layer of the skin and just beneath the skin. The third, and dermal layer, epidermal layer, dermal layer, and the inner layer. So after, within the very layer, that lastest layer of your skin, that skin contain this subcutaneous injection within that. And then the last one, which is mostly normally over injections or over drugs prescribed by the doctors, that is the oral administration. They are usually the tablets, usually the encapsulated formation, and some of the time some doctors give you the liquid injections to just take it with some sort of fruit, liquid, milk and juice and water. So
Mhm.
some of the doctors that also give you the oral administration of those drugs. So these are certain routes which are very much important when we talk about the therapeutics of your of any of sort of assembly and administration of any sort of drug within your body and their effect also. Uh, in all these routes, all these administration routes, the very first route which I have discussed earlier, that is the IM route, intravenous route. Any drug which you can take by this route, that is I already said this is the fastest one, and its effect is far more more effective,
More effective.
severe, faster, and sometimes adverse also. So if you are taking any drug through intravenous injections directly into the blood, so for a shorter period of time, their mode of action will help out your body. But when it gets to the excess of that drug within that body, and you are taking that drug again and again through the intravenous route, that will cause a hazardous effect on your brain system and your whole body, because your brain is going to control on your body. So that is the problem. So starting from the first till the last oral administration, and now you can only analyze that why doctor usually prescribe the oral administration routes of some of the tablets, because this route is slowest one. Your body first, when the any drug came into your stomach cavity, your digestive tract usually siphon out all the harmful chemicals and all those chemicals which cannot be easily absorbed by your body, so they are discarded away. And the only targeted chemicals which are good, or maybe they are the targeted one, or maybe some of the drug do contain some chemicals which can, you know give the false sensation to your body, and then they keenly absorb within the blood. So your first your stomach will eradicate all those chemicals, and then only the targeted chemicals will go into your body, and then your brain will sort it out that how it works. So the first route till the end route, as we have finalized these routes by their numbering, so their mode of action and their mode of the drug pharmacology, they do differ with their mode of treatment also, their therapeutics and their effect also. So next, what we have else within our these pharmacological aspects, if you can go to the next slide. Yeah, then a route of administration, and after that the some of the administration route which are very rare. So these three are very rare one. Normally most of the doctors do not contain these routes for all the patients and for everyone, so first is sublingual. Sublingual is also called as the buccal route. That is the route within your buccal cavities. Maybe some drugs you might have known and you might have seen in the very emergency cases, when there is a sudden heart stroke or a heart attack and patient will reach to the emergency, doctor will easily tear one drug and put it beneath your tongue. That is the sublingual administration. That is also because there is the salivary glands over there, and when the drug came in contact with those salivary gland, the drug will easily absorbed and ultimately go into the system very quickly, because with the help of enzyme, because all the enzyme, these enzyme which also present in the lining of your coronary arteries and your heart system, so those linings and those enzyme can help you out the sublingual administration route of drug to the area of your heart and your chest cavity. So these sublingual administration is very rare, and under certain circumstances with the extra care of those doctors. Then the second one, which is the second rarest thing, normally doctor do not opt for it, but in a very harsh conditions, that is an intrarectal administration route. Normally, these routes are adopted by those doctors, the patients who are claiming with some of the problems of the rectum area. Maybe most people have do not pass the stool with a longer period of time, and then they are
Yeah,
suppository
especially.
system, they are
Yes.
doing with that. And the third one is again the rarest one, and these patients which are doing these sort of administration of their drug, that is inhalation one. So they are also under a very rare circumstances. For example, so people with having some of the problems of their nasal cavity, chest cavity, or they have the compromised alveoli walls, usually the patient of asthma. So they are taking the inhalation system. So these are the route of administration which are very rare, and normally do not adopted by all the patients. So if you can switch on to the next slide. So okay, so this the route, which is the last one, which is the topical administration. This is also the administration in a very rare conditions. Rare conditions, you can say, in those conditions in which there is any scar, any operational management, and any cosmetological effects, and any other things which could be done by that. So doctors can give you some of the ointments, some of the or patches to drop it on your skin and your cavity and the upper layers of your skin, and that could be the again the rare part of the things. Not all the patients and not all the doctors can recommend you this
Yeah, sure.
application also. And then when we come to ICVs, this is the emergency and very rare cases. Any drug which is life saving, usually the patient of cancer patients who have the brain cancers or the tumors inside their brain, they take these ICVs, direct application of these drug to your cerebral roots. These injections are also under a very rare
A controlled
circumstances,
environment.
but and
Yes.
in the controlled environment you can also say that these routes are also not a very prolonged routes. Once, twice, thrice, and for a month. Other than that, doctor will not prolong this route of administration because this can be a life threatening also. So these again these routes are very rare and under a very special circumstances. Next, if we can, we route out to the next one. Okay, so now the second part of our talk will be the effectiveness of the drug. How the drug will give you the intended, effects, the results,
Yeah.
and the desired things which you want. For example, if I will talk about any pain inside your brain, inside your body, wherever the body get the pain, and you have to take some of the drug which are the painkillers or some of the muscle relaxants, and if you are taking some drugs with the oral administration, how drug will come to know that where the pain exists, because everything is under the chemical concentrations. Nobody gonna tell you that drug that here is a pain and you have to put your things and you have to assimilate the things from this particular part. So the thing is, whenever you take any drug, for example the painkiller, and if you have a pain in your
In your
if you
body.
have a headache and any part of your body, so what happens with the drug is the part of the body which have the pain, they exaggerate some sort of chemicals, or you can say the massive messengers in the form of neurotransmitters. The biggest neurotransmitter root of your body is the GABA receptors and GABA protein systems. They usually release within the body whenever you came into cross with the stress, anxiety, overexcitement, sudden shocks to your brain, sudden pain, any surgical injury, any accidental part. If your body is coming with all these sort of circumstances, the GABA proteins, the GABA receptors came into being, and they start soothing out the and calming your body, giving the relaxation of your body. So this is the natural system of your body, that how your body can take the things into the very cooler part. Then, secondly, when you take the drug, so these chemicals are already releasing to the site of the pain. The neurotransmitters are there. Your drug, for example, any drug, any painkiller, which is a famous painkiller, I'm not gonna, take the name of any painkiller over here too. So that is the main thing the people will take. Okay, so this painkiller was mentioned, so maybe this is very good one. No, every painkiller is giving you a very short period of time relaxation point. Otherwise, your GABA receptors has to be very commonly affect your body, and they are already doing it. Your drug, your painkiller will only help out those GABA receptors to find out the way and to give you the quickest recovery from that pain. So when the drug,
I have one question.
yeah,
I have one question, a simple question.
yeah, uh,
Uh, the basic thing is our body is accustomed to promoting the effect of homeostasis whenever anything opposite happens to the normal body conditions. For example, if there is anything wrong going on inside our body, so there are receptors in our body that will give a message to the central nervous system, and they will start focusing on all the mechanisms that promote homeostasis. So, should we rely on those homeostatic forms, or these drug effects should be introduced? Because, like for example, the normal headaches, should we use the drugs for them or not? Because the homeostasis is also working for the human body as well.
yeah. This is what Shaylee I'm telling you, because this is a very very important question you have put it out. Fine. What whenever we have some sort of injury in the form of like any sudden shock, when you have a stress and anxiety, people
Hmm.
rush towards the doctors and they ask some of the prescription, and those doctors are, I mean, considered very good doctors who are giving you the many medicines, and you take those medicine at once and then you feel very very good. So people will say that this doctor is very good, this one dose is so much effective that I am feeling very well. So no, your body with the mention you have mentioned, the homeostasis, exactly what our body is doing. These receptors, which we are called the GABA receptors, they are the covering up receptors. They are the covering up protein, covering up chemicals of your body. Whenever there is any problem, there is a disturbance in the homeostasis, all the body. These receptors, these proteins will come into the action, and they start their action releasing, calming, soothing the body in a very slow and steadily way. But if you can bear that pain, for example, if you make them busy in some of the things, if you can make them busy in some, I mean, watching some TV, and if you were to walk, or you
Exactly.
just busy yourself, so
Exactly.
your body will help you out to bring out from that situation. But when you will think about that pain, that problem, that particular situation again and again, and you are not changing your environment, and you want, or you ate some sort of drugs, you want the drug to be calming out. And usually we from starting from the children, now even the age of 6 or 7, your child know that there's a syrup who can help him out if he get some sort of fever. So they will
Yep.
ask you, okay, that mama or papa, please give us that syrup so that we can. So you know everything now. So now your brain has already trained that there is something, there is an aid you can take and you can calm it out. Otherwise, if you are not taking the drug, and if you are enduring that situation for a particular time period, your body will help you out. Your body will be more strong effect, but obviously body effect is very very slow and steady. It's not all of the sudden, but you have to be very much a bearing situation in that particular circumstances. But usually people do not wait, and they rush towards the things which can give them the sudden effects. So that is basically the effectiveness of drug, and that is also your brain system, your psychology, and in the clinical psychology, we usually talk about those people who are dependent. Fine.
Hmm.
Some of the
Yeah.
study which you shared with me, and you have underlined it, that was very very interesting. Some people who are addicted with tea, they take the too much tea, and even some people have they take so much of coffee, and early in the morning when they wake up, they want the cup of the coffee and they want the cup of the tea, and if they're not taking that, I mean, they think that no, our day is not yet started.
Exactly.
And that is the addiction basically. And that is again your brain system, your psyche. You train your body, you train your brain like that. In the Ramzan, which just has passed away in the few days back, we were I mean, enduring the whole day without the tea and without the coffee. and that is the easy exercise of your body, that you can exist, you can start your day, you can do your activities without the cup of tea and without the cup of the coffee. So this is
Yeah.
the training system, so that is, there are many studies who can say that this is the addiction. No, this is the shorter addiction, because the things are there, your kitchen is equipped with that. If you
Yeah.
are not, if you're just eradicating those things from your kitchen, from your house, you will be very much okay. After 1 or 2 days, your body will get to know that these things, we can endure the, entire over a day without these things, and you will be okay. So this is nothing like that, that you are addicted to some. Yes, there are some drugs which are very very impossible sometime to just eradicate all of the sudden. So that is why usually the good practitioners give you a very sudden eradication of those drugs. If they are prescribing you two tablets a day, then they will cut it down like for the one, and then they cut it out with the half, and then after that they will just eliminate that drug from your daily opportunity. So that
Yeah.
is the effectiveness, that some drugs, the response system of the drug basically is the effectiveness of the drug. Normally those drugs which can give you the effect within the minutes, 10 to 15 minutes, what they do, they suddenly thinning up your blood is highly thinned, and then that would be the very easy part to target that area which give you the pain sensation. So normally the aspirins do these things, and usually doctor use this aspirin as a sublingual administration at a very very those condition in which your body is going to be stroke and your heart is not pumping in a well manner. So those drugs can be effective. So there are many other drugs which are also having a very sudden effect. So that is the magnitude or time which a drug can take
Yeah.
to intend the things. And then there is a therapeutic index. We can say any drug which can give you the first 50% relaxation, 50% target to that area or to that pain. If they can eradicate the 50% of cessation or lessen that problem, that is the therapeutic index. And that those drugs could be the very very good drugs. They could be the under emergency drug, under the target of the emergency drugs. Likewise, within the animals and within the humans, we target the 50% effect of any drug, and then we can maintain the assurance that this drug is the effective or not. In the other slide, there is some sort of curves and the paragraphs which I have mentioned. If you can go to those curves, and yeah, this one. So these curves was adopted by a book from the pharmacology. The reference of the book is under this graph. So these are the four areas in which we have already talked that these drugs could be the things which can go towards the oral route, intranasal route, smoke route, or intravenous route. So you can say the most of the effectiveness of the drugs come towards the intravenous, and then the second part is the intranasal, because the nasal cavity is also again attached with your blood system and easily assimilate with the blood. The oral system has very very the lesson sort of the thing, and they have a very slow and steady effect on that. So the good effect is with the intravenous and the lesser effect with the oral administration. But good drugs are those which give you the 50% index within the oral administration system. Not all the drugs can be taken at the intravenous, but best drugs and all the drugs which could be the very best one, they are the good 50% ratio with the oral system. And then to the next one, if you can say another, yeah, this one. So this is the dose of drug. Okay, so this is also important to know that how the drug can affect on you. Many times, if you are taking a very low dose of any drug,
All right.
if you're taking a very low dose drugs, they if you take them for a longer period of time, and if your doctor suggests you to take this particular drug for a month, but do not exceed the amount, do not exceed the dose, that could be also a very opportunistic one and good for your health. Your body, your brain will not get problematic, will not get the problem with those therapeutic drugs. But in case if your doctor is prescribing you a very high amount of any therapeutic drug, I'm again saying therapeutic drug. Therapeutic drug means any drug which give you, which meant for the therapies, not for the normal use. So if your doctors are prescribing you the high amount of any therapeutic drug, they will prescribe you the days, 3 days, 4 days, or a week, not after that. And they are stick towards that, and then they will change those drugs with some of the mild drugs, and then slowly they will eradicate the drugs used within your daily system. So that is the dose of the drug. When you are taking the low drug, that will have a very good uh, relation with your blood and brain system, and your body will not get attached or not get addicted to that drug. But if you are taking all of the sudden the high dose of any drug, that will produce a very very strong effect, not only on your body, but first they will strongly affect your nervous system, your central nervous system. You may be the senseless, you may be feel some sort of sensation within your body, especially on your fingertips, toes,
Yeah,
in your
exactly.
brain area, in your lower brain area, neck area. Sometimes tingling can also happen. You can
Yeah,
be fainted. So these are also the symptoms that you are taking some drug in a very high amount. Normally, the females in which we interact on a daily basis, they go to the doctor and ask for some of the multivitamins. That please give us some of the multivitamins. And normally, females take the multivitamins for their skin, hair texture, and their fair color. For example, nowadays these are very much in
in fashion,
fashion.
in trend.
Yeah.
Yeah,
So these drugs can also give you adverse effects because you are taking the high amount of, for example, biotins. Biotins are very good for your skin and hairs and your nails also. But
yeah.
as all of the sudden, if you are take the dietary products, for example, egg or milk, your biotin content will hardly zero point 0.5 mg.
Oh,
But usually in the multivitamins, you can take the 4,000 milligrams of biotin at once with your one dose. So that is the highest amount, the highest dose you can say. So this
exactly.
dose is very very strong. You can get a very good skin with this dose. You can get a good texture of your hairs with this dose. But what else? Your body will feel pains, lethargy, and you will not feel active because that this biotin also uh, have with the aid with the calcium and with the vitamin D. If we are not taking the calcium and vitamin D with it, so normally the biotin in the solitary manner, they can give you adverse effect more than the good effects. You can say that. So that is the high and the low dose of the thing. So this is one of the very common example which we usually take. And nowadays, ladies, for example, the young age females, they are taking it for the good health and texture. But I can tell you that this high amount of any drug, even any multivitamin,
Mhm.
if you are taking even the calcium in a very high amount, so over deposition of calcium within your body can make your kidney upset.
Hyperglycemia.
Yeah.
Mm.
And even the cancer, some of the cancers, they are reported. You can see the studies of 2019. There was a paper that was published in the Nature journal that was highlighting the problem of taking over calcium. So if you're taking the over calcium, there was the cases most of in within the females of the breast cancer. So that can convert into very very adverse effects. So that is the low and the high intensity of any of the drug within the body. Then
There is another question,
Yeah.
just a simple question. Looking at this figure, it's written here that after this point, increasing the dose does not produce a stronger effect.
Yeah.
Now, for example, if I'm thinking about this sentence, I see that there might be a relation in which, when higher dose have been injected in it, the receptors in our body are not, they're not ready to bind to those drugs. That's why we don't feel that much a stronger effect. Am I right? Can it be
Yeah,
included?
yes, yeah. Sure, I will make it more simple like that. Once you go to the doctor for example, any bacterial infection, your doctor have given you, for example, antibiotics range for 250 mg,
All right.
right? And you recover within a week.
Mhm.
After some time, a year, a month, you again claim to go to the doctor and claim for some of other disease which is also produced by any bacteria, and your doctor analyze it, and the good practitioner will ask you the first question: either You have used any antibiotic before that? If you know or
Yeah.
remember the name of the antibiotic, please tell us. So what they are doing, basically, they will define the dose. If you have taken the 250 mg of any antibiotics before this situation which you are enduring nowadays, so
Hmm.
your doctor will give you the even stronger dose of any other antibiotics, not the same one. That is the we can say the biocompatibility of that drug within your body. Fine.
All right.
There are two terms, that is biocompatibility and biodegradability. Biocompatibility means you are already exposed to a certain dose. If the
Hmm.
same drug will be given to you in the same mgs, like 250 mg again,
Amount.
that will
Yeah.
not give you any effect. The same drug 500 mg give you a very very lesser effect because your body is already having the memory cells of that drug. So your body is already knowing that mode of action in a very good manner. So your doctor will change the antibiotics and also change the dose so that your body receptors will shock when the things will go inside. When the drug will go inside your body, your receptor will shock and try to absorb the things, try to do the mechanism, try to absorb the mechanism, and your drug can aid the action in a better way. So that is the thing basically. If you're increasing the dose from a certain period of time of the same things, your body will get very much friendly with that drug, and that is not going to be giving you the therapeutic effect. I hope I give you some of the clarity of the things.
Yeah, that was really great. Thank you very
Okay.
much. We can move on to the
Yeah.
above slides. I think
Okay.
we have to.
Okay,
Yeah.
no, this has been. I think these are some of the drugs which will be the last part of it. You can give you the last part of the slide, which has the brain reward system, and then these drugs will came into that one.
All
Okay,
right.
so
We.
yeah, no, this is the last one of the where there is a um, picture. Yes, this one. Okay, so this was what we talked about earlier also, and here I will assimilate all the neurotransmitter with this thing.
All
So
right.
I have already told you that your body and your brain will work on the reward system. What is reward in your body or in the terminology of your brain is whenever you are taking any drug, your body will get some of the disturbance. Fine. Even
Mm-hmm.
if you are taking the food, for example, you have snacks in your mid morning, and the snack was very 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 tasty for your taste buds, not for your tummy but your taste buds. So what your brain will do, your brain and the homeostasis of your body for by eating some that particular snack will disturb. um, when the snack will metabolize within your body will have the time to regain that homeostasis level of your body. So that is the reward system. We can also tell the people about this reward system in a very you know a very simple manner, that is the recycling. Your body
All right.
recycle itself. Any eating, any drug exposed to your body will take time to recycle the already mechanism which is entering or which was traveling into your body. So that is the reward system. Okay. Now, how your neurotransmitter work for it? The one neurotransmitter system which I have mentioned or I have talked about earlier, that is the GABA receptors.
Yeah.
Normally, these receptors are the soothing receptors, friendly receptors of your body. They will give you the calm, soothe, and the relaxation sensation within the very, very tense situation of your body. For example, shocks and any sort of injuries. Okay, once you take some drug to calm down your anxiety, your neurotransmitter, there are the list of neurotransmitters. Acetylcholine is the famous one, along with the GABA receptors. These neurotransmitters will help that drug to recognize the certain chemicals which are targeted. When the drug has been designed, every drug has three or two parts in it. The one part is the assimilation of the digestive tract, because it get to the oral system and your body has to digest it, metabolize it. So first covering of your drug will be to digest, to swallow within the digestive cavity. The second part of that drug or second component of that drug will be to assimilation or to have the capacity to cross that blood brain system. you know Normally we talked about the blood brain system is the very very hard system or hard barrier. Not every drug can cross the barrier. Only within even your body have the glucose that has only the capacity to cross that system. Otherwise no drug and no chemical can cross this system. So your drug has the component to cross the blood brain barrier and give you the a greater effect for a shorter or the longer period of time. Once you just cease the taking of that therapeutic drugs from your daily routine, and your treatment has been done and doctor told you that okay, now you don't need to continue these drugs more. Now what your brain will do, your brain will start the recycling, your brain will start the rewarding to your body.
All
That,
right.
and it will even take the 1 week, it will even take the 1 month towards your body to regain the system. That is why we usually recommend to the people that do not try to take the drug at once. For example, for the females, if you are taking with your monthly menstrual system, do not take the drug at that time. Do not initiate to take that drug on that period of time, because your body is already in the shocked condition and your body is taking up with another system of your body. And if you are starting any drug and you are starting any tablet to take of that, even it is the multivitamin, that could also be trigger other parts of your body, and your brain cannot reward it, your brain cannot regain or recycle the process immediately. So that is the thing. Your neurotransmitters, your body system, your drugs helping out your brain to reward the body once you will stop taking those drugs. But what happened whenever the brain will reward the system, some of the drugs which having the longer effect, they start craving. You people, you might have seen in the form of like opium, some sort of
Yep.
weeds, some sort of those drugs which can give you relaxation to your brain. People try to take those drugs again because your body, that opium, that weeds, and some those drugs which are called as abusers of drug, drug abuse, which we can target the name of the abusers of drugs.
They
Even the
basically want to,
alcohols. Yeah.
yeah, they basically want to suppress their receptors of the central nervous system. That's
Yeah.
why like they want to feel that sense of feeling gain. I think that's
Yeah.
the main
and
situation.
sometimes and sometimes for example, any kind of alcohol,
Exactly.
they mimic the system of GABA proteins, GABA receptors. So when they mimic the GABA receptors, and because GABA receptors are already for your body to cool down, to calm down to your body. So if they will mimic the system like GABA receptor, and then your body get to used to it, and that will be a very very problematic thing to eradicate those drugs and to recycle the brain reward system. That is the problem. So that is why some of the drugs, they can be very very difficult to prohibit it, or inhibitory effects of those drugs can be
Yeah,
very very
prevent
problematic.
yourself from.
Yeah, so you cannot prevent easily with that because of the disturbance in the recycling system and the mimicking of those drugs within your bodies. So these are some of the important factors. What brain and how your brain weaken. In the end, there is an example of antibiotics. Usually, why I have chosen this example of antibiotics, that is because we are usually encountered most of the antibiotics within our daily routine. Starting within the Pakistan, if I've talked about, starting from the first day of the baby till the death, we are exposed to too much, dose and too much sort of antibiotics in our daily routine. Usually, antibiotics are considered that they do not have a very longer effects on your body, any therapeutic effect on your body. But what happened? Some of the antibiotics can give you the worst effects and a very serious disease, which is called psychosis, that is disturbance and totally distortion of your central nervous system, even. This can lead to the seizures, and after that, this can lead to the epilepsy if it is adverse effects on your body in a very very you know longer period of time. So that was firstly this case study. I just suggested this case study over here that in 1945, that was the era when penicillin was newly discovered and was administered to all of the injured people within the World War II, because that was even the starting of this World War II, and then ending of it. Lots of injuries was there, and penicillin was working excellently on those injuries. And then the physicians of that time, they considered this penicillin as the god savers. They think that this penicillin can do the miracles, and they can treat the people, they can treat the armed forces and injured people for a very shorter period of time, but having a very longer. And so the dose was not defined at that time. So the overdosing of this penicillin even give the psychosis effects to their injured people. For example, the things are written over here that they feel the confusion, lethargy, some sort of anxiety. Some people reported into the coma. Seizures were all of the sudden. They documented it that there were serious effects within this penicillin. And then after that, they try to find out the mechanism that what happened basically. So then they would find out that the GABA receptors, again, these neurotransmitter, they mimic like the GABA receptor, the penicillin even, they mimic like the GABA receptor, and their body get to know it. And one, then you increase the overdosing of it, you increase the dose of it, your body can take into the massive excitement, and then your body start to be highly excited. You cannot be conscious, you cannot be concentrated to the one time and one area, and even your brain receptors can be inhibit or calm down to that bit, that much extent, that suddenly the patient go into the comas, unconsciousness, and totally distortion of whole body, and even they claim that that's. So that is the typical and a very very easy example which we can tell you the people, that the longer run, longer effects, and high dose of any drug, even it's a therapeutic drug, they can trigger the brain system, brain excitation system, and give you the adverse effects, the spasm and any sort of comas, any sort of cancers even. So your brain can endure the things, and your body can be distorted all of the sudden. So that is
All
the thing.
right. There's one general question from my side.
Mhm.
It's basically like what I've seen and observed in different media. That's basically when I was watching different kind of movies and series. So there were some war scenarios in which the soldiers, they were experimenting, they were experiencing some of the worst scenarios in which their arms and legs were cut off. In those situations, they were given the doses of adrenalines, and those adrenalines proved to be a better point for them, a better, you can say, medication for them. And then even in the courses, for example, if a person is going into a fight or there is a fight or flight situation, they also use adrenalines. My simple question is, if we increase the dosage of adrenaline, uh, like for for an instant, like instantly, a lot of adrenaline dosage, how will they disturb our brain system, and can it lead to psychosis, and also can it lead to all the seizures and spasms as well?
Okay, so the particular case of the adrenaline, adrenaline is the normal body secretion. Body secrete these adrenalines and the course when your body get, it's basically the formation. If you can see the formula of it, it's normally the epidermis. So your body normally secrete these adrenalines to, again, to calm down any sudden shock situation. Your body will be regain the or recycle their receptors, recycle their situation before or after the the sudden shock or anxiety. So when the adrenaline is give you the or administered from the outside to your body, again it will give you for a certain period of time, it will aid the brain, it will aid your body to
Exactly.
encounter that situation, any situation, any particular situation, even in
You
the
get like
wars.
super
Yeah,
active, like
you
you are
can get like,
super active.
yeah,
Yeah.
and you will be relaxed, and you can feel yourself that I can do anything. Overexcitement, you can be excited in that way. But all of a sudden, when the effect of this dose, the outer dose, that will, coming to the lower situation, and your body will recycle again itself, the brain will reward itself, then
Mhm.
again your body will distort. You will feel this confusion, you will feel this tingling, and even for the longer period of time, the psychosis problem is common in those people who are usually take these adrenalines in their daily routine, or in their particular situation when they not feel to cope up the situation, they take those drugs, and then they regain the situation, and after that they will get anything like that, they do not know where they are and how they are doing the things. So that is again the abuser drugs. I am just mentioning it. Those drugs which people are addicted to it,
All right.
and after some time they again take those drugs. The craving of the body, the need of that body. So your body do not need that drug basically. Your body miss that excitement, that energy which that drug gives to you for a shorter period of time. So your body and your neurotransmitter want that to again be in a working situation, because this lethargy, this confusion is the very hard situation for your body, because this is the adjustment of the homeostasis. So when till that the time, it will take more time to get that homeostasis. And those people who can endure, who cannot bear that time period, now they will ask you, and they will ask the doctors, they will ask anybody to give their the dose again, so that their body can suddenly go to that excitement again. So that is the thing. Any drug abuser, any therapeutic drug, a patient who are taking the habitual drugs, for a longer period of time, their body will regain in the same time period to till they have taken that drug. For example, if you are taking the drug for a 1 week, your body take the 1 week time to regain itself. If you are taking the any drug for a 1 month period of time, your body again need that 1 month to recycle itself. So that is the thing, and that also depend upon the the dose of that drug, that how much dose you are taking. So that is the thing, that is particular situation of the adrenaline too.
All right. I have another situation, another kind of question that I would like to ask. I can relate this whole topic of usage of drugs to my thesis in a sense of way. For example, my thesis is based on the effect, the stress factors that lead to the pathomechanism of Alzheimer's disease. So basically, during my thesis, what I learned was that throughout our life, the day we are born till the day we die, we are exposed to different kind of stress. It can be like different kind of stress. It can be mental, physical, or emotional. Now, all these stress factors, they put a very harmful effect on your body, but your body tends to cope it through its normal homeostatic system. The homeostatic system releases it controls the releases of cortisol, that is basically the stress relieving hormone. Uh, but for example, if the stress is being given to the person continuously, like if the stress has been introduced in the life of body, in the life of the humans on a continual basis, it will result in the dysfunction of the central nervous system structure that controls the release of cortisol. As a result, the brain structures, they start to deform, like they start to destruct, and as a result, we have this common disease that is known as Alzheimer's disease, and the dementia that forward leads on to dementia. So, uh, should we rely on all the drugs, or is there a better way? Because like we can easily rely on drugs to relieve stress, but what is your opinion? Would you suggest the usage of drugs on a normal basis whenever you need it, etc.?
Shamir, I must say your topic of your research is very, very important and very good piece of work
Hmm.
which you are doing,
Thank
and
you.
I hope it would be a good study. Uh, you know,
Thank you.
so what we can do is problem is that there's the word stress. We always take this word in a negative manner. You know,
Hmm.
whenever you talk about the stress, we can say that okay, the stress is the negative thing, and that is the the abuse of some kind or anything that could be a negative situation. But I must say the stress could be a positive one also. If you are overexcited for something, if your body is excited for some situation, for a particular person, you know, that is also a stress. But you can say this is a positive stress.
Hmm.
Your body will not absorb the high excitement also and high damage also.
All
So
right.
in both of the condition, your chemical and your homeostasis will disturb out, right? um, in these situations, what usually physician, clinical psychologist, and the most of the studies which have been done on the animals, for example, the monkeys. You know, monkeys are the
Hmm.
like the guinea pigs, and they are mostly alike to their functions to the human being and their receptors and their reactions also. So most of the studies which are run on the monkeys, they told us and or they tell us that if you change the situation, if you change the scenario, in another word, if you change the environment,
Yeah.
you can be easily cope with a certain situation without the help of any drug, I must say. Fine.
All right.
So this is
Yeah.
this is the thing. Change the situation, change the environment, leave that place for a particular time, leave that place for a certain period of time. When the two people are start argumenting, two people are
Hmm.
start talking to some of the thing. Some people get hypertensive, they get that blood pressure very high. So what we need to do is the one should walk away, or one should listen to that person, or change the topic. So in this way, what you will do, you will help your body to regain, to recycle, to reward, and you're also helping to the other person which you are talking about. So same way with the excitement. If you are very very excited for something, if you are very happy, that is also a stress condition of your body. Your body is not coping up with that particular situation. So that is also stress for your body. So change the environment, walk away from the person, change the topic of your thinking, busy yourself with some other task. So in this way, you will be not be dependent on some sort of drugs, even on the painkillers. Just change the environment, change your body position, do some other tasks. Your body will forget the sensation of that pain. You know that the sensation will give you the most effects when you start thinking about that pain. If you will think that okay, my I have a severe headache, I have a severe headache, so that will gonna be a severe headache towards you.
All right.
This study was we have conducted these studies, I will tell you. That
Hmm.
was the last year, because that was not the corona condition, and my students were working on that. We were working on the moringa, the moringa powder. That is the normal herb in the Pakistan, and we just crush it up and encapsulated it. That was documented that this moringa is also helping out the diabetic patients who have a very diabetes 1 and diabetes 2. In all the situation, this was also helping out to that patient. What we have done, we have experiments on the 10 the patients of the in the 10 groups of one experimental. One was the group was on the dose defining groups also. So we have given them the moringa capsules to the one group, and to the other group we have given them the capsules, but they were no filling of the moringa. They were weekend capsules, only
Hmm.
the shields of that. We recommend I recommend my the students that take their take their morning early morning sugar cases and report them. And when they after the month or two, those patients who are administered with the moringa capsules, they do have a very, I mean, mild effect, very slow effect, but that was a positive effect. But let me tell you, those people who are taking those vacant capsules, but they know that this has a drug, and they will be taking this drug, and they will gonna be very fine, because we were telling them that this drug is this much effective, and you will take it, and your body will be gonna do very good effects. And believe it or not, I just reported that study also, that those patients who were taking only the vacant capsules, but having the surety that this drug will gonna work, they were having the morning diabetes level were very much better than those people who were taking those moringa capsules. So that is
Mhm.
all the brain game, that is all the exercise of your brain. Whatever you will start teaching to yourself, that will be the part of your thinking system. If you will think towards that or negative situations or the positive situation to the too much level, that will giving you the distorted effects. And even this dementia, Alzheimer at the very last stages of your life, some people have the paralysis is very much common. The people
Mhm.
get heart strokes, that is common, just because they do not pull out themselves to the particular situations. So if you are take those situations on your daily basis, and you are not changing your environment, you will not be good, even with the help of these drugs, which you can call the therapeutic drugs. Your drug will not help you out until or unless you will not pulling out your body towards from that situation, away from that situation.
All right. I would also like to add now one kind of funny event that is related to your remark that whatever you teach to your brain. So there was one scenario where our professor was saying that his father, he was facing some depression issues and sleep disorders. So the professor was like really confused what to do, because there was no other way, because his father had to consume the sleep drugs in order to sleep betterly. In one scenario, it happened that they ran out of the sleeping pills. So his father couldn't sleep. He couldn't really sleep at all, and at that time in the night the shops were closed. So the professor, he just got a Panadol, that was a normal drug, and he just said that this is a sleeping pill, just take it and you can sleep. As soon as he took the pill, he just slept right away. So I would like to I would like to ask you to give a, give a short kind of message to all those people in our Pakistan, that when there is habituation with your drug to your nervous system, that can cause a greater dependability on those drugs, and this can cause a much better scenario, much worse scenario, much worse scenario for your normal life. You know.
Yeah, you're very much right. You're very much right. The things are similar. The people want the drug, but they do not think that this is all the thinking process and the exercise of your brain. Once you start doing the particular exercise with your brain will regain it, and you will not gonna, I mean, dependent on any sort of drugs. But once you are, you are helping your body with some sort of aid of the drug now, then you are not gonna be all right, even after you will stop taking those drugs. But still your body want to do that okay, take that drug, or that was the craving of that drug rather than anything else.
All right. Should we focus on all any other slide that you would like to, or is it just the end?
Okay, so we can give them an overview also. from starting till the end. We will
All right.
just it was just giving you the overview again to the people who want the things to what we have discussed today. So our talk today was on the psychopharmacology and the effect, basically the effect of drugs, importantly therapeutic drugs on your brain system. So we talked about the brain and the effectiveness of drug, starting from the routes of administration, and we told you about that how the route of administration can give you the effect of your brain or effect of your sight of the problem within your body. So we have started with the fastest and end with the least effective route, but that was a mild route that was adopted and that is adopted by the good physician. So we have started with the INs, the intravenous injections, which is the fastest route, and that is directly pouring the drug into your blood system. That is the major fluid of your body, and it is usually considered as the fastest route. You can see all the vaccines, all the the antibiotics, mostly antibiotics, doctors recommend you with the IV injections. So because now the COVID vaccination has been also started, and you also might have encountered all those people who have already vaccinated themselves. You are given the intravenous shots, and even one shot or two shots, whatever they were. So you are given the intravenous route because that is the fastest route. Your brain, your blood can regain the antibodies and recognize the things all of a sudden. And then the second route was intraperitoneal injection. That is the peritoneal cavity around your abdominal organs. That can be stomach, intestine, liver, and other abdominal agents. And I have given you the example of insulin injections in this scenario. uh, the third route which we have discussed was the intramuscular injection. That is the muscular injection. Usually, doctor pinch that muscle and give you the injection in that. The muscular injections are also the sort of the intravenous one, because from there also the blood supplies are encountered with those muscle, and drug can be easily poured within that fluid system. Then there's a subcutaneous injection system. That is the last layer of your skin. The three dermal layers, and then the end layer, which is this patch with your muscles. So that layer, usually TB tests are taken with that subcutaneous injections. So these are the fourth one route to give you any drug, which is usually adopted by the doctors. And then the last one route is the usual route but very slow and steady route. That is the oral administration. Most of the capsules, most of the tablets, and most of the drugs are given you by this route, because the digestive tract is involved in this route, and your most of the harmful chemicals, facilitator agents of the drug eradicated from the digestive cavity, and only the targeted chemicals will reach out the target area. So this was the normal usual route, which usually adopted by the doctors. And then we also talked about the rare roots. The rare roots are under the certain circumstances, under the certain emergency situation. From first was the bilingual, sublingual administration, that is beneath the trunk. This administration, which is also called as the buccal administration, your mouth cavity is involved, your salivary gland, exact on your salivary gland from beneath the tongue. These sort of drugs can be given to you. They are mostly the blood thinning drugs, and usually adopted by the heart doctors, and those doctors which are encountered by the patients of the heart stroke or the a heart attack. Then the interactor administration. This is the surgical administration. By the way, normally in a very emergency situation of any rectum disorder, any disorder of your your digestive tract and your the waste product tract, if that gets some sort of problem, so your rectum administration, the administration, and that is adopted one. And then the inhalation system. This is again the rare system in which your nasal cavity and your lungs are involved. Obviously, lungs contain the huge supply of blood capillaries, and the drug usually get into the blood system. But with the exposure to your lung walls, to the mucus of your lungs, so that the less mucus and the viscosity of that lungs can be maintained. So this inhalation system usually adopted by those patients who having the problem in their lungs. That is the a common example of them is asthma patients, basically. And then topical administration was discussed. That is the skin cosmetological
Mhm.
or aesthetologists, all the aesthetologist physicians who are doing the aesthetic surgeries, who are also giving you okay. Normally, the people who are very much involved in watching the cricket matches and the football matches, you might have seen that some of the when any cricketer or any player, go down to the ground and they have an injury or they have muscle pull, then suddenly a doctor came and there's a physician came and spray that area on the skin, and that the
Yeah,
spray and
exactly.
that patch is basically made up of that nicotine, give the sensation to the zero level. They're not treating that problem, they are just inhibiting those sensations which are triggering the central nervous system to sense that pain. So they just senseless that area so that there is no pain feeling to your brain system. Fine. So that is a topical administration I'm giving you. I hope this will be clear to the people. Then intracellular administration. These are those drugs which are usually cannot cross this blood-brain system, because your blood and brain barrier need lots of lipids, because this barrier is made up of the lipids. So if some drugs cannot cope with the lipid, cannot cope with that fatty acids, so they will directly pour into the brain. Usually ICVs are intracellular ventricular systems or intracellular administration. They are given to those patients who are claimed to the patients of like any sort of a tumor inside the brain cavity, the less amount of fluid inside the brain cavity. So those patients are giving these sort of injections directly to the brain system. Okay.
All right.
So then we have talked about the effectiveness of the drug, that is the dose response, how much dose can be given to the patients. So in which we have talked that some of the drugs, their magnitude and their effectiveness is based upon the 50% system or the 50% usage of that drug within the body. If the drugs is consumed to the 50% and give you the intended goal, you can say give you the required amount or required recovery to your body, that drug will be considered as the therapeutic index drug, and that can be the used as a therapeutic drug and approved by the authorities. Fine. So even if it's an animal cases or even it's a human cases, so this those can be defined. Then most drugs or most of them drugs can give you the optimum effects and more than one effect even. Fine. Like opiates, their first target is to reduce the pain. Fine. But these opiates or all those drugs who have opium in their chemical composition, they not only reduce the pain but also slow down your heartbeat. So that is the adverse effect that
All right.
opiates or the compound of these drugs can give it to you. Then they also give you a rare effect on your respiratory system. Once your heartbeat get depressed, you cannot easily inhale or exhale the oxygen, fine, and carbon dioxide. So that could be the lethal one. You may find many problems to take the inhale the oxygen. Then the therapeutic index of these drugs, for example, barbiturates and the tranquilizers, they are more than 100, not the 50%. We are talking about the half dose of that drug. But these drugs all of the sudden consume and pour inside the blood system, that they can give you the sudden effects and give you the 100% effect, even as comparison to some of the drugs who are giving you the 50% effect. So they are very effective but give you the adverse effects, on your body. Okay, so within the drug effectiveness, we categorize the three levels. First, we see that how the molecules within that chemical is ready to give the effect to your body. Okay, so that is the readiness of the molecules. Then high affinity of the drug, that is the biocompatibility and biodegradability. We talked about this in a very detailed manner, that some of the drugs give you compatibility with your body. They try to simulate, they try to find out a very friendly environment within the body and give you the steady effects even in their low concentration. But some of the drugs, they need higher doses to give you the better effects. So that is the high affinity, low concentration. Low affinity but in high concentration, that is a third scenario. Drug having a very low affinity but needs to be higher dose of it. Fine. So these are the levels of effectiveness of those some of the drugs. Then we talked in detail about the ranges of the administration system. You can say the very first one is the intravenous system, and that is already whenever you take any injection, that is IM. I just recommend you people that to kindly once read the paper or the flyer with that drug. They usually mention on these injections that these people who are having this much of weight of their body, for example 70 kg, 80 kg, 90 kg, they will take the this much mgs of the drug within their body. For example, if the patients have the 70 kg of their weight, so zero point 0.6 mg is the minimum amount per kg. So you can multiply the zero point 0.6 into the 80 kg, and then you define the dose for that particular person. If your body weight is like 60 or 50, then again intravenous weight, if some of the drug is zero point 0.6 mg per kg, or if some drugs may be like zero point 0.2 mg per kg, so you just multiply that milligrams with the weight of that person, and then you define the dose. So usually it is written with the flyers. So this intravenous route, why this is important to know, because not every drug can be measured with the kgs. Why this is important, usually the antibiotics are also, because this is the fastest way, directly pouring into the blood. So this could be the very the tense situation whenever the fastest way you are adopting the fastest way
Exactly.
of the drug. Then the second one is the the smoke one. You inhale or you smoke something directly or indirectly. That's why we not only recommend those people who are smoking or taking the nicotine by themselves, but the fume or the smoke they produce. The passive smokers who are not taking that the cigarettes, or not taking that much nicotine themselves, but they only smoke, inhale the smoke, that could be the harmful effect, because the second fastest route is the smoked one. The third fastest one is,
All
that
right.
is the smoked one. And the second one is intranasal, again the nasal cavity. This is also recommended by the, normally the asthma patients are adjusted their dose with their weight of the body. So that is again. And the very last one is the oral route again, the oral route with your body system, slow and steady route, mostly recommended by the doctors. Then we talked about the amount of the dose in over this graph, in which we talked that how much dose, the slower dose till the higher dose, and the particular system. You can show the flattening of this peak. That means from this part, if you are increasing the dose of a particular drug for a longer period of time, or you're taking that drug for a longer period of time, and then you suddenly increase that dose of that drug, there will be, I mean, almost zero effect, the stationary effect of your body, because your body is not gonna take that drug as a therapeutic one. Now your body will take that drug as a part of their system. So that is not the mechanism or the action of that drug on your body, not more than action of your body. So in a certain time, either you need to switch the drug, you need to doctor needs to switch your drugs, switch the prescription, or assimilate it with some other drugs, so that your body can take the drug in a shock condition. Whenever there's another drug in your body will get to know it and rush towards it. The neurotransmitter will trigger the body that absorb it and try to know it, that what comes inside your body. So that is the thing. Then after that, we talked about the effectiveness and the margin of the safety. So these dose curves will tell you that how the margin of safety will come. Any drug, every drug will give you the side effects. Every drug have the side effect. Even the painkillers have the side effect. Mostly the Panadol, the usual painkillers, can give you or can initiate the cancers within the patients. They can trigger the cancer or the tumors in the lower abdomen or in the ovaries also. So this scenario is only with the painkillers. I'm telling about the Panadols. If you are habitual to take the Panadol, so there is no margin of safety in them. And if you are taking the Panadol on the daily basis, your body can make up the situation, and body can be in a shock condition for a longer period of time, and that can create some sort of cancers, particularly in the females. So every dose of your drug, even it's low, even it's high, there is an in between of that dose. That is a margin of safety. If your doctor giving you all of the sudden a high dose for a particular period of time, he would know or she would know that what is the safety area, how much your body can endure this dose. So they will adjust the dose according to the situation. Some high doses they only stop with after taking like 3 to 4 days. Even I know my father was after the death of my mother, my father goes into the anxiety. So doctor has recommended him a high dose of relaxant, but only for the 3 days. And he restrict us that after the third day, you will not take this medicine, and he switched the medicine all of a sudden, because that is the margin of safety. Your body cannot endure with that high dose of drug for a longer period of time. That can be the worst effect. And then on the other hand, we talked about some of the neurotransmitter, I guess, that, okay, yeah, from the other one. Okay, so these are all the tolerance of the body, preservance of the body, homeostasis, and effect of the drug that was talked about. And in the next slide, we talked about, yes, the neurotransmitter. The very first neurotransmitter we have talked about, that acetylcholine, and we talked about the GABA receptor and GABA proteins in details. So acetylcholine, they are the primary receptors, primary secretors of your axons. You know that if you can take about the neuron system, and one neuron is made up of like three major things. It's had their dendrimers, their axon, and their cell body. So these axon, they are the travelers. They take the message towards the brain and take the reaction from the brain till that receptors. So acetylcholine is secreted within these axons to the afferent. One axon is the afferent with the A, and other one is the efferent, that is the E. Afferent one to receive the sensation, and efferent one for the effects with the actions from the brain. So whenever brain give you any message, any reaction, anything towards the receptor, they would give you to with the help of the acetylcholine. So they are the recognizers. So they are the prime neurotransmitter, which are the friendly with your body, and your body and system knows about them. So acetylcholine, any drug come into the being with your brain or your blood system, they must have the compatibility or biocompatibility with these neurotransmitter named as the acetylcholine. Fine. Normally they regulate your sleep patterns. Okay, so one situation I can tell you: if you are taking the Panadol extras, and if
All
you're
right.
taking the high amount of tea, for example, if you're working late night, and usually this I just work late night, so I take 1 cup of coffee or a 1 cup of tea with the more I mean, like, strong tea. So what happens to that? My sleep pattern will irregulate. What I have done,
Yeah.
I just inhibit the acetylcholine. I just inhibit the effect of acetylcholine, and that irregulate my sleep pattern. I can work, I can more work in the excitement. So after that, when the effect of those nicotine will slow down, I will feel the lethargy and the sleepy mood and confusion also. So this is the acetylcholine, that very famous and very friendly to your body. Then the another neurotransmitter within the neurotransmitters. So these are just co-partners. Acetyl CoA, that's a cofactor. The system, the
Coenzyme
enzymatic
A.
system, and the coenzyme. They are the helpers. In other words, to work better with the acetylcholine. And any drug should first co-fit, or should fit compatible with the cofactor of acetylcholine, and that is a CoA. So that should be compatible with this one, and then transferases that will transfer that drug throughout the axon until the brain system. Okay, so the next neurotransmitter was okay. So these were the drugs who are very much or good spectrum and good compatibility with these acetylcholine. So that is the first one is the botulinum toxin. They prevent and the release of terminal buttons. They can also antagonize, action and reaction of that acetylcholine. They can inhibit it. They can switch them off and switch them high or switch them low towards that. There's an example, a very interesting example of the black widow, that is spider venom. That spider venom that can produce or trigger the release of acetylcholine. So any venom, even the snake venom or spider venom, whenever the bite of the snake or the venomous spider can take, the doctor physician usually say that try to awake the patient. The patient should not sleep. The patient should not go to the sleepy
Yes,
condition. he
this was
should
a
he
common
should be
thing.
the conscious. So that is the
Yeah,
thing. So the acetylcholine will give you the sleepy effect. So anything venomous when into your body, so that will be triggering the high effect of the acetylcholine, and your body will give into the calm down situation. So that is the thing. So towards the next one, okay. So these were again the receptor and service system we have talked about. That. Okay, so then we will talk about in detail about the brain reward system, and that involved the recycling of your body, recycling of your adjustment of the homeostasis once you get any drug, any therapeutic drug or any abusive drug, any sort of drug. If your body is exposed towards the drugs, what happens to your body is your body will get to know that drug and behave according to the situation. But whenever you will stop taking those therapeutic drugs, your brain will take the time to regain itself or to adjust the homeostasis toward the similar level that was before taking those drugs. So that is named as the brain reward system, and usually your whole body work on it. Once you take the food, after 2 to 3 hours, your body adjusts the system and again regain the system after the 2 hours, and again you start craving for the food because now your homeostasis has been adjusted, and then
exactly.
this brain system and this reward system goes on. And then at the end, I think we also talked about some of the antibiotics, and I just talked about this situation that was happened in 1945. The penicillin, that was a lifesaver, godsaver drug at that time, that was antibiotics. But the higher amount of or higher administration of these penicillin even give the confusion, lethargy, coma, and even the lethal situation to the patients. That is due to the mimicking of the GABA proteins, and these GABA proteins usually are the countdowning, calming, and the relaxant of your body. That is the already present the system inside your body, and give you the relaxation system even in the anxiety and the worst situation of your life. So that was the little bit of
Hmm.
drug
Yep.
and their effects on our bodies. And then we have I think we talked about some of the things that even by not using the drug, you can train your system, train your body, train your chemical triggering to the situation, that without the help of any aid, you can regain your body with some situation in a proper manner. But that would take time. But we shall say that you should wait to the body, give time to the body to cope with the situation.
Yeah. I think we can conclude our presentation here. Thank you all for your attention, and we will be focusing on answering your questions. I'll stop sharing my screen here, and I'll just go back. All right. There's one question about forming a connection about one concept that is coming to my mind, and that is related to the therapeutic effects of drugs. Now, there is one phenomenon that I somehow searched online that was basically the gut microbes, the bacteria inside our gut, on our intestine system. Uh, Whatever we eat is whatever we become. So, as a result of what we consume in search of nutrition, so the good and bad bacteria, One is the good bacteria, one is the bad bacteria. They also tend to become more prominent in our body. So, for example, if we consume a healthy diet, so the good bacteria transform much more efficiently than if we consume the junk food that is not healthy for us. The bad bacteria are inside our body. Now, a time comes that the bad bacteria actually signals the central nervous system to consume those products again. That's why we feel a craving for, you can say, Coke, Pepsi, or you can say like French fries or burgers, whatever, like all those junk food. We feel a craving for it, and once we consume those products, we feel satisfaction. This is the connection of gut microbes related to your food consumption. Can I relate this same scenario of gut microbes to the usage of drugs as well or not?
So you mentioned some of the uh, you know um, um, the junk food in which you mentioned the coke snacks, the chips and everything. So the one thing is common in all. The coke contain the alcohol,
Mhm.
fine. So they are the mimicries, are they are what you can say the receptors, like the receptors of the GABA proteins. They mimic the GABA proteins. When you talk about the French fries, the high amount of starch, the starch ultimately consume into the metabolize into the glucose, and glucose can switch the blood brain system, and they can easily go throughout your body, throughout your brain, and give you the good effect of goodness. So these junks can contain those mimicry products who are, or you can say, which are mimicking the neurotransmitters. So that is why you will always crave with these junks. You will never crave the milk. You will never crave about the roti or chapati. You will never crave the curry. So you will always crave about the tea, coffee, or the coke. So that is the thing. With your microbiota, your good bacteria, which you have mentioned, that your good bacteria again, they are flourishing on the good hygienic routine. But when increased amount of alcohol, increased amount of starch will go inside your body, your good bacteria will again disturb their homeostasis, because their balance, their pH level, their temperature, their body lining, they can also disturb, and that is why the depressant of their culture, their microbiota will affect the increase in those chemicals to be more inside your body. Otherwise, mostly bacteria give you the effect of fullness after a bunch of meal you will take. They will give you the
All right.
fullness effect. But when you take the junk, they can easily assimilate, they can easily mimic to the neurotransmitters, and you will not find yourself as a full. Your tummy will not full with them. So you start taking them after some time, or continuously taking them. So that is basically the effect of the receptors on them, not with the, particularly with the biota. That is a receptors effect, because they are receiving it. They are not giving you the fullness effect of that.
All right.
Okay.
Uh, we will start moving on to the questions. We have our first question by Kiran Kainat. She says, "Can you please talk about antidepressant drugs?"
Yeah. We talked more about that the painkillers and antidepressants. So anxiety, depression. I just talked about that anxiety and depression could be of both type, positive and negative. There's a worst situation of your body. You go to the clinical psychologist, you go to the physician, and you talked about that okay, this is the situation, and they will recommend you some of the antidepressant. That will give you the relaxation, but they will recommend certain time. So they will give you the thing that for the 3 days, 4 days, or 5 days, more, not more than that, but because acetylcholine and GABA receptors, they are already settled with your patterns of your biological rhythm, yeah, or we can either say your biological system, the clock of your biological system, that is the rhythmic activity of your body. So when you start taking antidepressant after the excess amount of them, your body will not adjust their system, but rather they will be dependent upon these antidepressants. And
Oh,
what happen after that, you will crave for them. Without them, some of the people will tell you that I cannot sleep without taking that drug, because the problem is they are already taking it to the higher amount or the higher dose or the longer run of the time. So that
mhm.
is basic problem. So antidepressants are good under the consideration of any physician or the clinical psychologist, not by yourself, not by recommended your peer system and any friend or any family member. No, that is good under unless you are under the consideration of any doctor. Fine, and after some time, you should eradicate those or leave those medicine gradually. Again, gradually, not all of the sudden. Gradually, you can leave that medicine. Lesser the amount, half the amount, and then after that, you can cope up with the system so that your body recycle the biological rhythm again.
All right. Our colleague here, Eman Arif, she has come up with a good question. That is, can you please suggest any natural alternative of antihistamines? Because sometimes the body get used to it and doesn't cure the problem. What to do then?
Okay, so recommendations. Okay. Um, well, there is no recommendation. It's like that, antihistamines. Okay. So what you can do, Eamon, this question is because I just smile at this situation, because normally I used to tell my students also, because they get depressed and they get the anxiety, because the online system and the situation of the COVID, we are all at home. I mean, from starting from the 5-year-old child till the 30 years of all the students or the teachers, everyone, we all are staying home. So the problem is we are getting too much with this exposure of the multimedia. I mean, we are taking the Facebook, Instagram, and all the things with that. What happened? We have our brain have no time to relax. We are already very depressed. So sometimes I talk to my students and my classes that what you will do for a 1 hour of a time, only for a 1 hour a day, you just leave all your gadgets in a room and just start go into your the area in your outside the house or inside the house, or go
Mhm.
on the rooftop and start jumping, or start doing any exercise which can increase the heart rate. You know, not an
Yeah,
exercise even you can
exactly.
running.
I would
Start
second that.
running, start taking any exercise which can increase the heart rate, or in another word, you will feel yourself lethargic. So do that. So what will happen to your body? Your body will refresh it out. Like whenever your mobile phone or your gadgets will just hang up, normally people say refresh it or switch it off and again on it. So that is the thing. Your body will refresh whenever you will take any activity which will increase your heart rate. So that is the natural antihistaminic effect. You will find it your body in a very good position, in a very refreshing position. So try it, and then let us know in any other topics and what happened with it.
Yeah. All right. There's another question by Bushra. She's asking, can you please report any recent case related to antibiotic leading to psychosis? Any recent?
Busha, yes, this is very good question. Busha, this is a recent study with the COVID situation, because within the COVID scenario, there's a lots of antibiotics which people are using, because some of the misconceptions are that antibiotics can cope you up or can facilitate your body to treatment in the COVID infection. So people are even some of the physicians, they recommended the antibiotics with without any hesitation. So with this situation, most of the people, they are not only depressed with the more use of these antibiotics. They are either having the confusion and lethargic effect, dementia and some of the coma and stroking effects of their sudden strokes and sudden the seizure situation recommended, and that is the report of China and Germany, especially, that is published in the BMJ journals. You can search them out. That is the 2020 and the 2021 January 2021 paper. The two series of the papers, they only talked about the effect of antibiotics in the situation of the COVID patients. So they report some of the problems which they entangle. So you can just search it out, or otherwise, in the comment section, I will also put the name of that paper that was published from the BMG journals, especially, and the name of the authors are Richard and Y. Schwann. They are one from the Germany and one from the China instance. So you can read that paper, and you can see they have reported some of the effects.
I think the Pakistani people were afraid from the COVID vaccines because they were thinking Bill Gates is trying to change their DNA. But anyways,
No, no, Bill Gates is trying to, Bill Gates can even, he cannot handle his wife, but the way he said, he will handle all the Pakistanis with that chip. So that is the
exactly.
situation basically.
Okay, there's another question by MNRF. She's saying, how to relax one's brains in the excitation state other than just changing the environment?
Laugh.
Or, yeah, any kind of physical
Yeah.
activity that can
That
change your
can be.
mood. Yeah,
The
peripherally.
change in environment, I didn't mention, Eamon, I didn't mention about that. The change environment doesn't mean that you should, go from Lahore to another city. If the people in Lahore is problematic with you and you will just all of a sudden change your city. No, environment mean internal and external, micro and macro. We talked about all the environments. Micro environment is within your body, and macro is outside of the environment. So your micro environment is just changed by your mood. Just switch the mood, uh, start any activity, you will be very relaxed. So that is the thing. That was the basic thing, the message which I want to share with you.
Okay, I think we are almost done with the questions. I think you would be pretty tired as well. But
No, because
yeah,
you have talked about the Bill Gates, so this, I was just thinking to know that what happened and what is the situation in nowadays, that chip and everything.
yeah, yeah, yeah.
So, yeah.
But anyways, there's one last question from Emin Arif. Can you discuss drug resistance? Yeah.
Okay, so I think mostly drug resistance is meant for like antiviral and antibiotics. Usually, we talked about the antibiotics and their resistance within the body and their usage. And I just give the one example of any physician or any drug. Augmentants are usual in Pakistan, 250, 500, 1000 mgs, and usually people are taking them without any hesitation, without the prescription of the doctor. So that get any antibiotic and even antiviral, when once you get exposed to the certain dose or certain mgs of it, for the next period of time, you will not get be therapized, or you'll not get the effective effects of it towards your body with the same dose. So that is the resistance, and that is the basic thing which drugs can do. And they are resisting within the your body. They can resist the mechanism of action because the memory cells and anti bodies that is developed inside the body. So this is resistance is particularly for the antibiotics and antivirals, or the anti-inflammatory drugs, not for all other drugs. That other drugs can, on the higher dose, can minimize their effect, but you will not resist, obviously. For the other therapeutic drugs, you are not going to resist them, but you can minimize the action of them within your body.
All right. I would like to ask one last question from my side. What do you see the future of drugs? For example, when we are seeing all these futuristic movies that show that there are several drugs which enhance your intellectual capability, which enhance your physical capability, and like several scenarios where like superhumans. Can there be a possibility that in the near future these type of drugs which give you superhuman powers, like for example enhanced cognitive learning and enhanced physical activity on a normal basis, like a normal person can get these drugs and perform all the superhuman activities, be a nuclear person in life? Is there a possibility? Do you see a future for it?
Well, Shri, when you talk about the fiction movies and all the inspirational movies, the science fiction, for
Hmm.
example, so they will talk about like Spider-Man, Superman, all the superhuman beings. So
Yeah,
Spider,
yeah.
Spider just bite them, and he just have all the abilities of the spider, and genes have been modified to that level that
Hmm.
they can get all the things of the
But
spider.
there are
Okay.
other drugs as well. There are other specific drugs. They have done the research and
So
stuff.
okay, yeah.
That yeah.
So okay, so this is because being a molecular biologist, also I can tell you that even also our students, all the biotechnologists know better that over genes are sometimes two genes control or one gene control more than one characters within your body.
All right.
Your in gene of your IQ gene, which is donated by the mitochondrial DNA from your mother, not from your father, that is responsible for your IQ level. Okay, so this gene is also controlling the effect of your behavior, for example, your action and reaction to certain situations. So
Hmm.
there was a study in the Nature journal that was published back in 2001, in which they have certain experimental monkeys with them, and in them they have injected some of the genes and some of the alterations which can enhance the cognitive ability and even the IQ level of some of the monkeys. So what they observed, that those monkeys who have the high IQ level, who have best cognitive abilities, this on the second hand, what they have do, they were highly angry beings. They get angry reactions to the every situation. They get hyper easy. So what they analyze, that your IQ level gene is also controlling the gene of your action of fight and flight situation. So whenever there is a high IQ, the person with a high IQ level, on the other hand, that was the person will be the highest hyper activity of their brain. So they will hyper all of the sudden. They will get the angry reaction to all of the sudden. So they will not be the moderate, or you can say the mild people within their situations. So that is the problem. That is the thing which we need to tackle. We can make the superhumans, but we can also tackle some of the other effects which after being them. So because in the fiction movies, the Superman and the Spider-Man, they are very cool and calm and helping. They're kind of doing the welfare of the mankind. But in the reality, when the higher IQ level people having the higher anger rate, also that will not gonna give you the welfare effects. So this could be the thing. That is only purely based on the molecular background. I can let you know. Then maybe there must be some of the studies which are going on, and they can switch on or switch off some of the effects of the genes. So they may be like most of the people like that. So you can see that all the people in the history, even having the highest IQ level, like the Einstein,
Hmm.
he has used the brain at the maximum level. But what
Yeah.
else in the second life? He was not a very happy man in his own personal life. In
Yeah.
all the person, he was best in the scientific things, thinking and the scenarios, but he was not at all the very moderate person in his personal life. So that is the problem. So maybe we can do the things with the, but not with the drugs. I think it's a molecular addiction or alteration.
Yeah.
The Bill
Totally.
Gates is also talking about this. So he is the inserting the chips, inside the Pakistanis, so Pakistanis can do some wonders. So that is the thing which they do.
Yeah.
That's the thing.
Totally. 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 Anything. Anyways, I would like to end our discussion here, our webinar. I would like to pay my deepest gratitude to Miss Sadia. She has given such a nice presentation, and me too. Like I have learned a lot from her, and that was a pleasant experience. We advise you to join in our next upcoming webinars as well. For now, we say goodbye, Allah Hafiz, and see you again.